Uninsured Utahns this week want to figure out how the health care reform law will help them and when.
Among them are people with pre-existing conditions eager for immediate care and financial relief. Jed Bowl introduces us to a young woman battling multiple sclerosis without insurance.
A month ago, doctors diagnosed Samantha Grams with multiple sclerosis. She suspected she had the disease last fall.
I had to walk really slow, or else I felt like as if I was going to fall over, and then it just got worse and worse from there. My eyesight in my right eye started to go, and then I could barely even walk.
But she feared the diagnosis.
Then I knew. I was like, I need to see a doctor, but I was too. I didn't have the money, and B, I didn't want to have a pre-diagnosed condition.
Grams knew that would disqualify her for affordable health care, and she and her husband had already started that paperwork. Both of them were students when they were married and part-time workers. And even when her husband went full-time, they didn't have a good affordable option through his work. Eventually, Grams had to stop working and school.
I just couldn't hold on anymore. I had to see a doctor, and as soon as he saw me, he put me in the hospital for 2 weeks.
The insurance that would have kicked in March 1st was denied. Her $1,600 a month medications to manage the MS will soon grow to $5,000 a month for the rest of her life, and she already owes $28,000 for the hospital stay. She's eager to get new federal help for the uninsured with pre-existing conditions. A temporary solution should be available in 90 days.
It will help them eventually. There's no doubt about that. The question is, what are the mechanics of that help and the timing of that?
Utah Health Policy Project Executive Director Judy Hillman says her office is getting calls from many Utahns who want to find out how the law will help them. Grams will likely be eligible for a so-called interim high-risk pool for the uninsured with pre-existing conditions.
She is biding her time until 2014 when the more fundamental changes come into effect, and that is where she will be able to get full, affordable coverage.
Just like everyone else.
Since I've been diagnosed, all I've been really worried about is not the disease. I've been worried about my money and how I'm supposed to pay for this.
She plans to pursue a nursing career and looks forward to walking and running again without trouble. In Murray, Jed Bowl, KSL 5 News.
The state office that will handle health care revision, the provision reform, has 90 days to enact the program to help high-risk uninsured patients, but there are still a lot of unanswered questions. Utahns seeking help will need to be patient while administrators work out the details. We put a couple of helpful links.